Okay. For everyone, please turn on the camera and use the virtual background before I start the session. Thank you very much. Can you hear my voice clearly?
Yes.
Okay, we will start our session for physiotherapist room. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Okay, good afternoon, everybody. We are delighted to welcome all of the physiotherapists oral presenter in the International Conference on Health and Wellbeing 2023. First of all, let me introduce myself. My name is Rina. I come from the Department of Physiotherapy, Universitas Muhammadiyah Surakarta, and I will be the moderator for this opportunity. Before we start, I will explain the rules for all presenters to follow. The first rule, during the session, every presenter should turn the camera on and use the virtual background that the committee is provided. The second rule, each presenter will have 10 minutes to present the slides and 5 minutes for question and answer session. So if you have any questions after every presenter finish presenting, you can raise your hand in the system and you can unmute the audio and deliver your questions. And then the next, in every track director will have the best oral presenter that will score from their presentation will be announced in the last session after all presenters present the slides. The fourth, and after all sessions have finished, all of the presenter can directly leave the breakout room without return to the main room. All presenter, do you have any questions about the rule? Okay, if not, we can start. Yeah, without any further ado, we will start our oral presentation session. The first oral presentation will be the invited oral presenter from Konkan University, Thailand. That will be delivered by Ms. Susandi Latun with the topic entitled Influential Factors Contributing for the Stroke Recovery. You will have 10 minutes for presenting your slide. Okay, the time is yours.
Thank you, Rina, for inviting me. Do you see my slide?
Yeah, I can see it.
Yeah. Okay. 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 Let me start. Assalamualaikum. Good afternoon, everyone, and welcome my presentation. My name is Ms. Susandi Khaton, a PhD candidate from Human Movement Sciences, Faculty of Associated Medical Sciences, Konkan University, Thailand. First of all, I'm thankful to this conference for allowing me to present this occasion. Now, I would like to present my presentation entitled with Influencer Factor for Contributing Stroke Recovery and Review. Today, I will present about 4 parts. In the abstract, stroke is a major public health problem affecting disability to people. And after stroke, deficits in motor function impact mobility of patients' ability to perform tasks in everyday life, social interaction, likelihood to continuing work. Recovery of stroke is important for the survivor to return to daily life. Several factors influencing the stroke recovery and predict the condition of the patient to obtain the optimal rehabilitative therapeutic individually. Therefore, the aim of this presentation is to evaluate the influential factor contributing to stroke recovery. When the clinician from the rehabilitation team have a better understanding of this individualized factor, therapeutic goal can become holistic effective and realistic for the patient to achieve the maximum motor function recovery after stroke. In introduction, stroke is a major consequence of cerebrovascular disease. Higher prevalence of stroke is related with the history of hypertension, diabetes mellitus, dyslipidemia, hypercholesterolemia, older age, male gender, and occupational class. There are three major influential factors contributing to stroke recovery. They are socio-demographic factors, including age, race, socio-economic status, and other factors. The second major factor is the clinical factor, including stroke subtype, location and site of stroke, severity of stroke, the initial injury, post-stroke depression, comorbidities, rehabilitation, therapeutics. The third one is the genetic factors. In the first major factor, first of all, age is one of the factors. There is, for the older age patients with stroke, they have poor recovery in their strokes. And second one is the race. Asian, Pacific Islanders, and Marooney have a higher dependence after stroke rather than European. Asian have lower rate of death after stroke, and Pacific Islander have higher rate of death after stroke. The third one is the socio-economic status, including household income, educational level, and insurance status are influenced in the stroke recovery. Poor recovery outcome may result from delays or failure to access rehabilitation program brought on the insurance and insurance. The fourth one is other factors, including disease awareness, mistrust, marital status, caregiver support solutions, quality of life, healthcare system, access, self-efficacy, and activities of daily living can also influence the stroke recovery. In the second major factor, the first one is the stroke subtype. The two common types are hemorrhagic stroke and ischemic stroke. Those can change the acute and chronic therapeutic pattern. Hemorrhagic stroke patients have increased functional disability, and intracranial hemorrhage can recover more clearly and quickly than ischemic strokes of the same intensity. Between ischemic stroke and hemorrhagic stroke, there is no difference in recovery. The second one is the location and site of the stroke. The location of the anatomical damage limits the amount of function recovering in upper extremity. Upper extremity recovery became decreased with lesion in the sites such as the cortex, corona, radiate, posterior limb of the internal capsule during the acute phase of stroke. Moreover, damage to the subcortical region correlates with suboptimal upper extremity motor function throughout the subacute phase. Trauma to the abdomen, insular, and white matter thread primarily affects upper extremity motor ability in the subacute period after the left hemisphere trauma. In the chronic phase, damage in the limit to the white matter thread, and injury to the cortical and subcortical region, including insular, white matter thread, basal ganglia, impact the upper extremity function after right hemisphere damage in both stages. When the patients with the right and left hemisphere damage were assembled, differences in motor recovery occur based on the differences between the dominant left hand and the non-dominant right cerebral hemisphere in the functional neuroanatomy of the motor control. After receiving bilateral upper extremity training, patients with right hand dominant stroke who have a motor dominant stroke left hemisphere lesion exhibit a response advantage in patients with motor non-dominant stroke, right hemisphere lesion. Depending on the site of the stroke, treatment strategy of the upper extremity hemiparesis may need to be more carefully chosen individually. The third one is the severity of stroke. More than 3 months of follow-up, patients with severe and moderate ischemic stroke validate sustained enhancements with the use of neurological and functional level. Patients with minor deficits has faster recovery than more severe deficits. Patients with more severe impairment state, severe motor recovery. Opposite to the current recovery model with a severe stage, some stroke patients with motor deficits, such as hemiplegia, may recover within 10 days after stroke. The fourth is the initial injury. Severity of initial injury is essential in long-term and functional healing. More severely and acutely motor impairment have more severely and chronically deficits. Effective thrombolytic therapy can lessen chronic deficits. Stroke recovery is the greatest improvement during the 30 days after stroke. And then after 90 days, severe and moderate initial impairment patient can improve recovery. But patients with less severe disability can improve to moderate or mild deficits, needing some assistance. The fifth one is the post-stroke depression. It can be occur in 1/3 of patients with stroke. It is the most prevalent neuropsychiatric condition after stroke. Several factors contributing to post-stroke depression, including history of depression, female gender, stressful life events prior to the stroke, and a significantly physically disability. After a stroke, antidepressants aid in cognitive and physical recovery. Antidepressants can also alter serotonergic transmission, which prolong the time of neuroplasticity and influence activities in the primary motor cortex. The sixth one is the comorbidities, including uncontrolled diabetes, discharge-related comorbidities, urinary tract infection can prolong hospital stay, impede recovery, and raise medical expense during the acute phase of stroke. The seventh one is the rehabilitation therapeutic. The effect of various rehabilitation therapies, such as treatment type, timing, and dosage, all play a part in chronic motor recovery. Nowadays, constraint-induced movement therapy and task-oriented training are neurorehabilitation treatment to improve upper extremity motor recovery in chronic stroke patients. Typically, occupational therapy and physical therapy in helping people to restore their motor ability after a stroke. The combinatory approach can help minimizing their window of brain plasticity. Developing therapies alter the healing process. The last factor is the genetic factor. Multiple single nucleotide polymorphism linked to increased risk or severity of ischemic strokes, influence inter-individual heterogeneity in recovery of stroke could take consequences in personalized rehabilitation regime. Polymorphism in the gene may affect all stroke recovery. BDNF is the one of the polymorphism in the gene, which is the neurotrophic factor that supports learning, synaptic plasticity, and memory in the brain. In conclusion, this research aims to assess the factor influencing stroke recovery. Improved knowledge of the pathophysiology and recovery process following a stroke can complete existing therapeutic expertise and improve novel rehabilitation approach. Depending on the post-stroke neurophysiological and neuropathological characteristics, physical therapists and other medical experts can combine numerous therapy modalities and approach to produce accessibility and effective neurorehabilitation therapies. To improve the recovery of stroke, the factor impacting the post-stroke recovery can be coordinated and customized in the comprehensive rehabilitation plan. I would like to acknowledge 2020 KKU Scholarship for ASEAN and GNS country. And I also would like to thank my dissertation examination committee, including my advisor, co-advisor, internet fee expert, and program representative teachers. Thank you very much for your kind attention. Questions and suggestions are welcome.
Okay, great presentation. Thank you very much for Ms. Susandi. For another presenter, is there any questions for Ms. Susandi? The title is Influential Factors Contributing for the Stroke Recovery. Yeah, so from the presentation, I can conclude some from the presentation, yeah, about The influential factors that contribute for the stroke recovery, that is from age, race, and then socioeconomic and other factors that include disease awareness, marital status, and etc. And another that clinical factors that include stroke subtype, that hemorrhagic and ischemic stroke, and then the location and site of stroke, the severity of stroke, the initial injury, post-stroke depression, comorbidities, rehabilitation therapeutic, and then the last is genetic factors. Okay. From another person, is there any questions?
Yes, Miss Rita.
Okay, no. Yeah, maybe if you have any question, you can chat in the room chat. Yeah, in the room chat, and then Miss Susandi will answer it later. Okay. Thank you, Miss Susandi, for the nice presentation. We will continue to the next oral presenter. The second oral presentation will be delivered by Mrs. Wahyuni with the topic entitled The Relationship Between the Habits of Walking in the Morning with of Pain and Functional of Knee Osteoarthritis. Mrs. Wahyuni will have 10 minutes to present the slides and 5 minutes for question and answer session. Okay, the time is yours.
Okay, thank you, Ms. Rina. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay, I want to share screen. This is my study with my student. I'm sorry, the title is it's not correct. My title, my study title is the relationship between the habit of walking in the morning with with pain and functional of knee osteoarthritis. I'm sorry. Yeah, as we know that the number of elderly in the world is quite high. In the seminar before, we can see that the number of elderly is almost 15% in Indonesia. In the future, there will many people who need some treatment to maintain their movement and function. So here is physiotherapy, trying to give some treatment that prepare by I mean this is like local wisdom. It is the habit of walking in the morning. Okay, here I will present introduction, method, and then result and discussion, conclusion, and reference. Okay, let me slide show. This is the background. Osteoarthritis of the knee can occur due to various factors, yeah, both primary or secondary. The main factor is unknown, but we know that the risk factor of osteoarthritis is some. It is namely about BMI. The higher of BMI have some risk to osteoarthritis, and then like the older and trauma and other. According to WHO, the life of several 100 million people on average will be disrupted due to bone or joint disorder. Disorder in the form of degeneration usually begin at the age of 40 to 15 years old, and the majority, about 90%, enjoying that accumulate by body weight, as I said before. One of the gene disorder that play in a role in lowering human ability, namely osteoarthritis, especially osteoarthritis of the knee or genuine, with 151 million sufferers worldwide and reaching 24 million people in the Southeast Asia region. In Indonesia, the prevalence of osteoarthritis reached 5% at the age before 40 years old, 30% at the age 40 to 60, and 65% at the age after 60 years. We can see that when we the number of our age increase, the number of prevalent osteoarthritis increase too, and this is prevalence of women is quite high, and especially the OA in knee have about 15.5%. The complaint of the patient with osteoarthritis is pain, especially pain and functional limitation. I think I have not to read all of my slide again, and this is the purpose of my study, to determine the relationship between walking habit, the complaint of pain and functional need in the elderly who have OA. The method is observational analytic with cross-sectional approach, conducted at Posyandu. Posyandu is like, what is it? What can I say? There's like the center of some elderly to control their health. This place in Kartasura. This research has received ethical visibility from Dr. Surjono Magelang Hospital. The number is here. The population of the study is about 50 people. It is the member of Posyandu, all elderly Posyandu. And they have to be assessed by the American College of Rheumatology about OA. Sample are taken using purposive sampling with the inclusion criteria: elderly willing to be research subject, it's more than 60 years, cooperative as long as they are respondent. The exclusion is have broken bone, drug, and have other heart disease. And we found 33 people to be a respondent in our study. This is the result of our study. This is the characteristic of respondent. The age majority is 60 to, I'm sorry, the age is 45 to 19. 60 to 74, it's about 78.8%. The gender, female is majority, about 81.8. The BMI, the normal BMI is majority, and about the school senior high school, university school is higher. Pain intensity, pain about 67%. This is the statistical test. We have we use chi-square. The number of PPU is 0.0442. And this is the relationship between habit, between walking habit in the morning with functional activity. Yes, this is my discussion. Aging condition. The loss of the ability of tissue and cell in the body to maintain homeostasis, as we know, especially when experience stress. How you know that majority of osteoarthritis patient is elderly. Based on the result of research analysis, so that osteoarthritis of knee is suffered by the elderly with an age range of 60 to 75. This is according with research by conduct by Runan in 2019, which said that the incidence of osteoarthritis is highest at the age of 60 to 75. About sex, I think we know that the female is more than male. It is because our hormonal have a highest role to our body, include our bone. About BMI, overweight is obese that high risk of osteoarthritis, especially affected by obesity after 50 years old, when young are teen. Yeah, it's sometimes we know that when we getting old, our BMI increase too. That will be risk factor to get OA. Okay. About the functional activity, is a person's ability to carry out basic daily activity normally. This activity involves movement in skeletal muscle that require more energy than the resting fast. This is an important factor in energy balance of the body, including activities carried out while playing, working, doing house traveling, and recreational activity. Yeah, as we know that functional activity is complex activity. This is about TL or activity daily living, and something make us like recreational activity. According to Lonica et al., functional activity is the ability of the person. Yeah, I don't repeat our statement. In osteoarthritis of the knee, there is generally limitation of extension movement, but knee flexion is often reduced. I think sometimes we complain on quadricep and hamstring muscle. There are several factors that cause a decrease of the scope of movement of the joint, including change in the joint structure, shortening of muscle and tendon around the joint due to pain and weakness. And patients with osteoarthritis generally experience a decrease in functional ability. It is because the pain make us to limited our movement, and then limited our movement make the functional of our body will be decreased too. This is the conclusion. There is a relationship between morning walking habit with complex of pain and functional knee osteoarthritis. Walking recommendation for the elderly who suffer from osteoarthritis are by modifying the dose according to the condition of the elderly, so that muscle ability can function optimally and functional ability can increase. I think walking is the exercise. So exercise will help us to decrease our pain, and when our pain decrease, the functional activity will increase. Okay, this is our reference. Thank you.
Okay, thank you very much for Mrs. Wahyuni. Is there any questions from another presenter who want to ask Mrs. Wahyuni about the topic, the relationship between the habits of walking in the morning with complaint of pain and functional of knee osteoarthritis? Is there any questions? Okay, if you have any questions, I will conclude from the presentation. The higher the BMI, the higher the risk to get the knee osteoarthritis, and the prevalence in women is quite high compared to the men. The lost ability of tissue and cells in the body to maintain homeostasis as all of people age. The highest incidence in knee osteoarthritis is at the age of 60 to 75 years old. In other than that, there have some factors that influence the height of incidence of knee osteoarthritis is from gender and BMI. Pain limit the movement, so the functional ability will decrease. And there is the relationship between morning habit in complaint of pain and functional knee, since the walking is the exercise which will help to decrease the pain, which will increase the functional of ability. Okay, thank you very much for Mrs. Wanyuni for the nice presentation. We will continue to the next oral presenter that will be delivered by Mrs. Umi Budi Rahayu with the topic entitled Important Items to Consider Regarding Post-Stroke Balance Training, Content Validity. Mrs. Umi Budi Rahayu, can you share the screen?
Yes, thank you, Miss Rina. I would like to share screen my PPT.
Okay. You will have 10 minutes to present the slides and 5 minutes for question and answer session. Okay, the time is...
Okay, thank you. Well, yeah. Thank you, Miss Rina. Please introduce myself. My name is Umi Budi Rahayu, and today I would like to present my research with title Important Item to Consider Regarding Post-Stroke Balance Training and Content Validity. And background in this, my research are balance is one of the main problem after stroke. Balance is also correlated with the number of falls. It has been reported that the incident of fall in stroke patient in the previous years is 20% due to loss of balance when walking. Second, a study on the issue of effectiveness of post-stroke balance therapy are still being conducted. A systematic review show that most of studies on the problem and effectiveness of the post-stroke balance therapy have poor methodological quality, timing the ability to draw a clear implication, as well as complex impact analysis after exercises. Many factors influence balance function optimization, including increased age, severe early motor impairment, and muscle strength of the affected lower extremities, particularly the ankle plantar flexor, which are strongly associated with poor balance function early after stroke. And this fact solve the importance of area related to balance. Therefore, validity related to post-stroke balance is needed, especially important items related to post-stroke balance. The purpose of my student are especially in this study, was to create a table of specification for important item and sub-items that evaluate the main component of post-stroke balance problem. And then their intervention, and so that they cover all related items. And the second of my purposes was to assess the content validity of the set of items based on the experts' evaluation of the previously formulated statement. Yeah. And then my method in this, my research, especially in participant, that the sample was compressed of 60 experts, including neurologists and senior physical therapy, especially neurological physical therapy with years of experience, who volunteered to participate in this study. And then the instrument of my study in the form of 50 statements related to post-stroke balance have been created, including statement of the stroke balance problem, diagnosis of post-stroke balance, and principle of the post-stroke balance therapy. So several general articles and on task creation and adaptation were also read. Okay, and to account of the content validity ratio or CVR formula was used to calculate the validity content with a value range of -1 to 1, and the content validity index formula was used with value range of 0 to 1. And the formula of the content validity ratio and content validity index by Arya et al. In this formula. And then a Y value of a statement item was determined by the statement's important and unimportant. Important value was coded as 1, while unimportant value were coded of 0. If necessary, experts are also given the opportunity to express of their opinion. Well, and the result of many item important regarded balance devise 3 sub-statement. The first, post-stroke balance problem, related neuron cell damage in the brain, case weakness on one side of the body, and then plasticity and neurorestoration, a time dependent, so treatment must be conducted at the appropriate time, especially in early treatment, and then postural hyperkinesis is caused by postural hypotension and muscle imbalance. Neglect occurred when the patient unconsciously ignore the affected site on the body as if it does not exist. Cognitive impairment, perception, and body awareness all contribute to a reduced understanding of movement. And then the last statement about postural balance problem is movement control and sensation are both impaired. And then the second statement is postural balance diagnosis. And the statement related distribution and performing and maintaining static on dynamic position is measured using a measurable and standardized tool. And then the importance of the body response feedback is important statement. And last statement item is principle of postural balance therapy. This item related treatment includes stimulation on both the affected and normal side, ability to understand movement and maintaining high concentration or focus while performing dual or multitasking. Exercising body awareness is very important. Treatment and doses need to be considered, and prioritize patient safety is important too. The exercise interesting and easy to do, and it doesn't confuse the patient. And the last, balance exercise must be designed and combined in a comprehensive manner, involving all of the area. The value of CVR and CVA, you can see that many items as important, expected, and postural hypokinesis in cause postural hypotension and imbalance, because the statement have CVA value less than 1. And the second, the expert just not important related principle of postural balance therapy, especially that treatment includes stimulation on both the affected and normal side. Well, so important statement item were classified into 3 areas. There are postural balance problem, postural balance diagnosis, and postural balance therapy principle. The level of validity based on the high CVR and CVI assessment so that the content of the item was by theory and purpose of therapy by expert could be identified important item with an emphasis on 13 item which need to be considered by physiotherapy in providing postural balance exercises. And finally, the existence of the statement item had a score that can be considered valid for 13 items. And 2 items that were less valid because the value of CVI less than 1 point. And this item also solve a slight problem of understanding, particularly the postural hypokinesis item due to postural hypotension and postural muscle imbalance. And treatment with stimulation on the affected and normal side. The expert have opinion that 2 item is not important. Yeah, according to the CVI result, that 2 items saw less significant result according to some experts. process will involve 60 experts evaluating the 15 statement item included additional information and modification that if clarify several items in written statement and 10 statement. While the CVR result were generally acceptable, all statement items were acceptable, except for two that show values with the minimal limit. There are postural hypokyphosis caused by postural hypotension, and postural muscle imbalance, as well as treatment with stimulation on both the affected and normal side. Therefore, researchers did not need to delete these two items. And the conclusion in my study that the test of content validity was adequate, and it discovered an important item that must be considered when providing a post-stroke balance training. This is my presentation for my research. Thank you very much.
Okay, thank you very much for Mrs. Umi Budiayu for the wonderful and interesting presentation with the topic entitled Important Items to Consider Regarding Post-Stroke Balance Training for Content Validity. Okay, for another presenter, is there any question for Mrs. Umi Budi Rahayu's presentation? Is there any questions? Okay, if you don't have any questions, I will summary some from the presentation. Balance is the main problem of stroke, and many factors influence balance function optimization. The increasing of age, the severe early motor impairment, muscle strain that affected the lower extremity, and etc. There were some important statements that was used to consider regarding post-stroke balance training, the post-stroke balance problem items, post-stroke balance diagnosis items, of post-stroke balance therapy items. And from the study, the existence of the statement items got the score that can be considered valid for 13 items, which this content validity must be considered when providing post-stroke balance training. Okay, thank you very much for Mrs. Umi Widirahayu for this great presentation. We will step to the next presenter. The oral presentation will be delivered by Mr. Adnan Faris Naufal with the topic entitled The Effects of Exergames on Static Balance Performance for Children with Flat Foot, a quasi-experimental study. The same as another presenter, you will have 10 minutes to present the slides and 5 minutes for question and answer session. Okay.
Okay, fine.
Yeah. Okay, you can start your presentation.
Yeah. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Adnan Faris Naufal. I'm a lecturer in Department of Physical Therapy in Universitas India Surakarta. Today I will present an article entitled The Effect of Exergame on Static Balance Performance for Children with Flat Foot, a quasi-experiment study. This research was actually carried out in 2021 using a sample of children in an area close my place of the work. Okay, in the introduction, flat foot is a regular observation in typical developing children. However, some children with flat feet present with pain in impaired physical function. which may include their balance performance. Flexible flat foot, also known as pes planus or planus vagus in children, when there is the appearance of the lower medial longitudinal arcus with real foot eversion. The majority of the children with their impairment will report resistance to speech physical therapy in invention. A flat foot is a pathological condition often encountered in children. About 40% of flat foot is conditional, where the foot medial arcus is lost, resulting is subtalar joint compression that may cause the internal rotation. Balance is defined as the individual ability to maintain the body of control the fulcrum in the particular position. According to Widyastuti in 2018, balance is a person's ability to maintain posture and body position with a quick reaction when standing static balance or when making a moving dynamic balance. Balance is divided into two, namely fixed emotional balance. Static balance has a narrow or small space to move. Scores are standing in a bit of placing without the body narrow of a small space, the point of movement. Sorry. And the exam game is the highly successfully game is recent years. In the children with musculoskeletal problem, in so positive results such improved movement and balance. This activity in increased movement in children of all age. Exercise game require player to stimulate the whole body to actively play a direct role with the game. One of the exercise game is a balance board or the bubble board. There is combined with the exercise game. The exercise game does not only perform physical activities, but also train cognitive, balance, and visual function. Therefore, exercise game can encourage children who have physical activity but have a low static balance level. In the method, this research was experimental random pre and post control group design. The initial activity was filled with introduction and screening of footprint as a flat foot examination, and data were optional from 30 TPA children. 19 of whom from a flat foot. Wait. The participant divided into intervention group A and control group A. This research was conducted from the mode of the Visionary Clinic in November to December 2021. A participant, their present provide written informed consent for participation. The research at committee of the Faculty of Medicine, Universitas Muhammadiyah Surakarta, Java, the last number, this is it. Okay, this is the result. The sample in this study was 16 to 9 years from Amanda Gonilan Kindergarten. The sample were individual into group where the intervention group was provided balance board exergame and the control group was given education to student and their guardian. The following in the data analysis table. Okay. In this table, describe the study subject characteristic. He saw the mean age of children with flat foot has 7.5 years old. Mean of flat foot degree before intervention was 8.25. Mean of the static score before intervention was 4.81. Mean of dynamic balance score before intervention was 42.56. This is a table 2. So the result of independent t-test to estimate mean difference of flat foot degree, static balance, and dynamic balance between group before and after intervention. Table 2 solve the before intervention. There were no significant difference of flat foot degree, static balance, and dynamic balance. Dynamic balance between intervention and control group. Indicate that sample characteristic in the both intervention and control group were comparably distributed. After intervention, independent t-test result, there was significant difference of static balance score in the intervention group and control group. There was no significant difference of dynamic balance score in the intervention group and control group. There was no significant difference of flat foot degree in the intervention group and control group. Okay, in the discussion, flat foot result in physical problem with muscle activation that can lead to function disorder, including balance disorder, coordination disorder, and muscle weakness. In future research, conduct the flat foot is one of the cause balance problem in the human body. Flat foot in children at 3 years is at 62.8 and 15 at 6 years. In Surakarta, 27.5% of the children aged 6 to 12 years experience flat foot condition. Research condition identified in 2021 mentioned that there is a relationship between flat foot and static balance in the children aged 20 years. In flat foot, there is a generally and direct in the muscle strength and muscle endurance relate to functional activity, especially the ability to mobility and decrease balance. It also results in the decrease in flexor digitorum longus, brevis, lumbricalis, flexor hallucis longus muscle strength. Because of the 2B inactivity, so it decrease the intrinsic muscle strength to the leg, both in the neuromuscular junction and in the muscle fiber. Hence, the balance component is not fulfilled. However, this condition can be overcome by providing physical therapy intervention. The excellent intervention provision of the influence coordination, therefore it can stimulate proprioceptive to work, and the proprioceptive can analyze the positive sensation and send feedback in the aspect muscle condition form. With the proprioceptive function return, the joint will more stable. Thus, they will increase the ability to balance the body that will strain the lower limb muscle from the hip to the foot and ankle, which have a major effect on maintaining body stability, hence to humans in a balanced position. In this exercise, there must be good coordination between muscle strength, flexibility, proprioceptive, and leg muscle. And the last slide, and this is my reference to in the my paper. Okay, thank you, Mrs. Rina.
Okay, thank you very much for Mr. Adnan Faris Novel for the nice presentation. For another presenter, is there any question for Mr. Adnan's presentation?
I think no question. Okay, next the presentation maybe.
Okay, if you don't have questions, I will summarize some from the presentation of Mr. Adnan. The flat foot is pathological condition and it might cause limitation in the activity of children in daily living. Imbalance is the ability to maintain the body control. The exergame is used to stimulate whole body to activate play a direct role with the game. The exergame can encourage for the children who has balance control problem, who has flat foot condition. During in flat foot sufferers, they have a decrease in muscle strength and muscle endurance related to functional activity. With the proprioception function return due to the application of the exergame, the joint will be more stable, which increase the ability of balance, and it is the major effect for stability of the flat foot condition. Oh, we got a question for Mr. Adnan. Okay, from Miss Susandi. Thank you very much for your presentation. I would like to know how to measure static and dynamic balance in your study. Okay, you can answer it, Mr. Adnan. During your study, how you measure static and dynamic balance of the patient?
My measure work balance scale. Yeah.
Okay, Mr. Adnan used work balance scale to measure the static and dynamic balance. Okay, is there the feedback from Ms. Susandi?
Cukup.
Okay, yeah, it's enough or okay, enough. Okay, thank you very much for the questions and thank you very much for Mr. Adnan for the nice presentation. So we will continue to the next oral presentation that will be delivered by Mrs. Rini Lestari with the topic entitled Elderly Exercise to Improve the Mental Health of the Elderly at the Nursing Home. Mrs. Rini Lestari, okay, you can share your screen. You have 10 minutes to present the slides and 5 minutes for question and answer session. Okay, the time is yours.
Thank you for the time. Thank you, Miss Rina. I will to present my article that the title Elderly Exercise to Improve the Mental Health of the Older People at the Nursing Homes. Okay. Okay. The number of older people in Indonesia was 31,320,006 people in 2022. The increase of older people results in social, mental, and physical problems. Mental health problems are often found in the older people. This is related to several life events such as change in position, retirement, decline in the mental and physical condition, death of a partner, and shrinking of spiritual and social group. Some older people live alone because of the death of their partner and are abandoned by their children who have started families and moved away. This can trigger feeling of loneliness. Okay. Older people who are alone, lonely, and underprivileged can choose the alternative of living in a nursing homes. Older people should enjoy their day happily, calm, not lonely, and healthy with their family and close relatives. In reality, many older people experience worrying conditions that reduce their mental health status. From the research, we know that 5 older people from 5 different families experience stress in the severe category. 61.8% older people experience severe level of stress. 35 people of 63 older people at the nursing home experience feeling of high anxiety and restlessness, which could interfere with their daily activity. Mental health is a state completeness that includes the absence of mental illness and a high level of well-being. 2 aspects of mental health are psychological distress and psychological well-being. Psychological distress is a condition of an individual poor or negative mental health, such as anxiety, stress, depression, and loss of control. Psychological well-being can be seen from indicators such as life satisfaction, emotional ties, and general positive effect. One of the factors influences mental health is physical condition. One of the healthiest activities is gymnastics or exercise because it has several benefits. One type of exercise that is good for older people is low-intensity exercise. Low-impact exercise can reduce tension in the body so that it does not make the elder body stiff and can carry out daily activities. Several studies show that exercise for older people can reduce stress and depression levels, improve mood, and help maintain the physical fitness of older people and reducing anxiety. Increase the amount and quality of sleep, quality of life, and psychological well-being. This research examined the effect of elderly exercise to improve the mental health of the older people at the nursing homes. And the method? This is a quantitative experience research. The subject were 12 older women who live in nursing home. Elder exercise is carried out in 3 sessions, each session 30 to 40 minutes, including warm-up and cool-down, to measure the mental health of older people using the mental health inventory. The effectiveness of the treatment can be seen from the differences in the average score of the PHI before the treatment and after the treatment. The data analysis with the Wilcox length test. The exercise is flexible, not stiff, dynamic, and easy for older people, with a series of plain and regular tonal movements. Elderly exercise movement include warm-ups, core exercises, and cool down. Warming up aims to prepare the function of all the people's body organs so that they can receive a heavier training load during the actual training. Core training movements include a variety of main movements that are dynamic, flexible, and not stiff. The cooling movement aims to make all the people's body condition fresh and fit again, like before exercise, by carry out a series of movements in the form of stretching. Everyday exercise can increase mental health score by 10.42 from an average of 106.58 before treatment to 117 after treatment. The mental health of older people is in the medium category. The statistical analysis shows that there are significant differences in mental health in older people before and after given elderly exercise. Thus, elderly exercise can improve the people's mental health in nursing homes. Elderly exercise can improve the mental health of the older people in nursing home because there are forms of physical movement to obtain agility, muscle strength, physical stamina, joint flexibility, endurance, balance of movement, and freshness. Elderly exercise can also trigger the production of endorphin hormones in the body. This hormone can cause joy and happiness or euphoria, reducing pain and stress. When people feel happy, they can carry out their activity optimally. Elderly exercise can also positively affect because there is a social support from other subjects. Group exercise or practicing with a friend can benefit parents by providing motivation, socialization, and the opportunity to share with others. The conclusion: elderly exercise can improve older people's mental health in nursing home. The mental health in older people in nursing home is in the medium category. Thank you for your time. Thank you, Ms. Rina.
Okay, thank you very much, Mrs. Rini Lestari, for the nice presentation. Next, is there any question for Mrs. Rini Lestari? The topic entitled Elderly Exercise to Improve the Mental Health of the Elderly at the Nursing. Okay, is there any questions? Okay, if no questions, I will summarize some from Mrs. Rini Lestari presentation. Mental health problems are often found in the older people, and the older people experience worrying condition which reduce their health status. One of factors that influence mental health is physical condition, and the healthiest activity is gymnastic or exercise, which will affect their mental health status. And the statistical analysis in Mrs. Rini Lestari's study showed the significant difference in mental health in elderly after exercise, because there are forms of physical movement that obtain the elderly ability of muscle strength, and then physical stamina, joint flexibility, and etc. Okay, that's all. Yeah, thank you very much for your nice presentation, Mrs. Rina Lestari. We will continue to the next presenter. Our last presenter is Mrs. Wahyuni, because she submitted two papers, so she should present both, with the topic entitled The Correlations Between Body Mass Index, Physical Activity, and Dysmenorrhea Levels in Adolescents. The same as before, you have 10 minutes for presentation and 5 minutes for question and answer session. Miss Yuni,
Okay,
you
thank
can
you.
share your screen.
Okay, thank you, Miss Rina. Assalamualaikum warahmatullahi. Let me present my study. Okay. The title is the correlation between body mass index or BMI with PA, physical activity, and dysmenorrhea level in adolescent. The study is study at Asalam Senior High School. This is our neighbor. Okay, I will start to present. Yes, as a woman, commonly the problem of us every month is menstruation. Yeah, menstruation is physiologically, but sometimes make us uncomfort and sometimes loss of activity, loss of uh, school hours or other. I will present the introduction, method, result, and discussion, conclusion, and reference. This is the background of study. Dysmenorrhea is from the word dis, mean difficult, menoman, and roy flow. We can see that dysmenorrhea is the difficulty of flow every month, but it is not enough about the flow of but the impact of difficulty of flow is pain and sometimes loss of activity. There are two kinds of dysmenorrhea, namely primary dysmenorrhea and secondary dysmenorrhea. That primary is dysmenorrhea without pathological condition, and secondary dysmenorrhea is dysmenorrhea with pathological condition such as endometriosis, fibroid, and other. Based on level of pain, we can divide the dysmenorrhea for 3 levels: mild, moderate, and severe. This is the prevalent. Globally, it's more than 50% women complain dysmenorrhea. The highest is in Oman, about 94%, and the lowest is in Egypt, about 34%, and in Indonesia, about 64.25%. This is the severe of dysmenorrhea. 45% mild or moderate, and 25 severe. This is about from Santoso on 2008. 20.48% mild pain, according to Junior. And Mandat, 10 to 20% is severe. And Habibi said that 30.3% mild, 36.5 moderate, and 33.2% severe. We can see that this is the problem of us about pain when we are menstruation. The symptom of dysmenorrhea, the main symptom is pain in middle, lower, and genital and stomach area, back, head, and breast. And then emesis, diarrhea, abdominal spasm, fatigue, weakness, uncomfortable feeling, sleep disorder, and acne. Yes, there are many complaints or symptoms in dysmenorrhea. This is the risk factor, many risk factor too. Namely, age of marriage, parity, how many we have children, socioeconomic, how condition of our socio-economic, smoking, as we know that smoke will make our blood contract, that make the blood flow will disturb. Contraception, family history, education and religion, PA or physical activity, BMI, various nutritional lifestyle factor, and stress. Yeah, I think lifestyle factor is the main of some problem in our life. I don't. This is from study in Indonesia. Sorry. This is the impact of dysmenorrhea. The first one is impact on quality of life, decrease school performance, reduce social functioning, need for medication, work absenteeism, physical limitation, activity limitation. Yeah, as we know that sometimes we need medication, but medication must be consumed every month. It can be risk to disturb our gastrin. This is the treatment. There are some treatment for dysmenorrhea. The first is pharmacological. We can use NSAID, example aspirin, naproxen, ibuprofen, and mefenamic acid. Pharmacological. We can use complementary therapy, physiotherapy, dietary supplement, lifestyle modification, and surgical. We can use endometrial ablation. Of course, this condition like endometriosis. No, I think Indonesian woman use NSAID, but sometimes we use traditional herb, but traditional herb in our country not endorsed for safe and standardized for doses that make hazard for our body. The objective of the study is to determine the relationship between body mass index and physical activity with dysmenorrhea level in adolescent. Material and method. This study is observational with cross-sectional design. The place of study is the School of Asalam, PTMI. Yeah. This is pesantren. Pesantren is boarding school of Islam. The study is conducted at March to September 2021. Population is was the student of PPMI Asylum. Of course, woman. This sampling method with non-probability sampling with two-positive sampling, and the criterion or the inclusion criterion, the age of respondent is 15 to 19, menstruating regularly after having menstruation, not taking any drug, and the exclusion criteria having a history of reproductive organ surgery, routine treatment that interfere with the menstrual cycle, bleeding outside menstruation. And we found 154 respondents for this study. Okay, this is our ethic permit from medical faculty. And the instrument of the study is the characteristic of respondent about class, age, date of birth, weight, height, and then pain measured by NRS, numerical rating scale, and PA measured by short IPAC, International Physical Activity Questionnaire. This is our result. Age. The majority of it is 17 to 19. The age of Maynard's majority is normal, 12 to 15. Duration of pain, 5 to 7 days. This is quite long. Primary dysmenorrhea is having from 152 respondent. It is about 92.2%. It means that majority of students having no pathological condition in their body. Dysmenorrhea level, this is no pain, mild, and the majority is moderate level. It's about 46.8%. Body mass index. The majority is, sorry. Like I can present it. Okay, this is the correlation between PA and BMI and pain intensity. PA with pain level, value of the number of value chi-square is 0.389, and BMI with pain intensity is 0.272. I think that no relationship between PA and BMI with intensity. This is our discussion. Okay. The intensity of pain due to dysmenorrhea will decrease with age as the body has adapted to the increase in prostaglandin and the uterine nerves begin to experience intensity. Yeah. From Maynard's age, majority is normal. This is from the study conducted by Vigno Sastro and in Bedu 2021. Maynard's age is divided into 3 categories, namely early, before 12, average, 12 to 15, and late Maynard's, after 15. The average age of Maynard student in Asylum is normally 12 to 15. It is in line with Purdue study, said that there were as many as 50 students out of a total 79 respondents who experienced average Maynard at Makassar National High School. Early Maynard lead to an early ovulatory cycle, so that dysmenorrhea symptom will also occur earlier. Early menarche is affected by increased estrogen level that can aggravate menstrual pain or dysmenorrhea. The relationship between estrogen level and dysmenorrhea resulted from prostaglandin synthesis stimulated by increases estrogen level. About prevalence, 92.2% of 154 students Asalam High School. It is about 142 respondents feel pain in menstruation. It is in line with the study of Risniyati and Wiborini, which state that the prevalence of students at senior high school 7 Surakarta who suffer from primary dysmenorrhea is 89.8%. Almost same. The level of dysmenorrhea, moderate dysmenorrhea, is majority with percentage 46.8%. Well, correspondent with degree 0, which means not feeling pain, are not experiencing primary dysmenorrhea. Only a small part of 12 students with a percentage of 7.8%. The study is compared with Nahra and Andalas that conduct at Syah Kuala Banda Aceh University, who mentioned that most respondent was with moderate dysmenorrhea. Dysmenorrhea occur when the endometrium is in the secretion phase and offer product prostaglandin, which cause increased contraction of the uterine muscle, and it can cause pain. Then the pain is various level. The degree of pain during menstruation that a person feels varies depending on threshold of pain or resistance of each individual pain to something felt. This is about BMI. 102 students normal BMI or 66.2%. Normal BMI occur due to a regular diet and adequate and balanced nutrition intake according to the body need. This is supported by Asalam Restaurant section, which has provided everyday student food and drink need with a good and diverse menu. The menu consists of rice, vegetable, fried dishes like tofu, soya bean cake, egg, meat, fruit, milk, yogurt, and others. This result is in line with study that conducted by Wijayaswari Pandey and Purnawati in 2016 of Udayana University student, where respondents with normal BMI have 64.2%. This is a PA or physical activity. In the medium category, 93 students with a percentage of 60.4%. None of the students had light physical activity. One of the reasons the majority of students have physical activity, the moderate category, is because the intensity of walking of the student is relatively high. The large area of Salam Cottage and student daily routine are quite dense to make them often move from one place to another place with food. Every prayer time, study hours, meal, laundry, afternoon extracurricular activity, buying snack, and activity that have been scheduled make the student often walk from dormitories to mosque, classes, restaurant, laundry place, canteen, and other place is as needed. especially for students who live in dormitory that have 3 floors. In addition to walking, they also often go up and down stairs. These results are comparable to the study by Nur Latifiana, conducted at 2019, which conducted at Taruna Al-Ansleman boarding school, where most of the respondents had moderate physical activity, about 80%, and there were no respondents with light PA. This is the relationship between PMI and PT. There is no meaningful relationship between PMI and primary dysmenorrhea level. The absence of relationship can occur due to several factors related to the student nutrition, excessive sugar intake among students who come from tea provided by Asylum restaurant every breakfast is one of the factors. Excessive sugar intake increase the absorption of specific vitamin and mineral and causes food instability. The nutrition causes muscle spasm and pain in the menstrual cycle. This is a statement by Wahin et al. At 2014. Lack of fish consumption of the student because the Asylum restaurant rarely provides side dishes in form of fish. Fish main mechanism, it is the oil of fish is prevent prostaglandin synthesis because it contains omega-3 fatty acids. The more omega-3 fatty acids consumed, the easier it will be to enter to polylipid membrane. During menstruation, omega-3 fatty acid will compete with omega-6 fatty acid to produce prostaglandin and leukotriene. Prostaglandin produced by omega-3 fatty acids are less potent and can reduce myometrium and blood vessel contraction. In addition, omega-3 and omega-6 fatty acid will also inhibit the production of arachidonic acid on animal fat, especially meat, is the synthesis of prostaglandin that cause the uterine muscle to contract, so the pain arises during menstruation. This is the relationship between PA and PD, or primary dysmenorrhea. There was as many 65.6% of students with moderate category PA with heavy category physical 67.2% students with heavy category physical activity who experience moderate to severe primary dysmenorrhea. Students with moderate category PA most experiment primary dysmenorrhea with moderate heavy duty. There was no meaningful relationship though between PA and primary dysmenorrhea. IPAC result used to measure activity level showed that most respondents had moderate category physical activity but still experience moderate to severe degree dysmenorrhea. This finding happened because the physical activity performed is a regular daily activity such as walking, sitting for a long time, going up and down stairs, and sweeping the room, not exercise or to exercise. The PA carried out is not severe and less than optimal. So it does not have an influence that can reduce pain during menstruation. Another factor, primary dysmenorrhea, is the stress experienced by a student due to the COVID-19 pandemic, because the PPMI Asalam pandemic prohibit students from leaving the cottage complex and meeting parents and families who come to visit. Nah, this make them stress. Stress can reduce the body resistance to pain. When a person is in the state of stress, there will be tension and contraction of the muscle in the body, including the stress occur due to increased activity of the sympathetic nerves, prostaglandin secretions, presence of the hormone estrogen, and the hormone adrenaline in the body, which cause excessive uterine contraction that cause pain during menstruation. Okay, this is my conclusion. There is no relationship between BMI or PA with the degree of primary dysmenorrhea in adolescent. Study at the student of Asalam High School. This is our brief reference. Okay, thank you, Ms. Runa. It's time for you.
Okay, thank you very much for Mrs. Wahyuni for the interesting topic. Yeah, because I think almost all of the women experience dysmenorrhea. Okay, because the time is up, so I will summarize some from the presentation. During the body mass index, physical activity is one of the risk factors that includes and influence the dysmenorrhea level, which will impact the decrease in the quality of life, school performance, social functioning, increase the medication consumption, work absenteeism, limitation of functional activity. And from the study, there was no meaningful relationship between physical activity, BMI, to the level of the pain intensity of the dysmenorrhea. The degree of pain during menstruation depending on the threshold of pain or the resistance of each individual's pain that they feel due to the several factors related to the student's nutrition. Excessive sugar intake increase the absorption of specific vitamin and mineral that cause the food instability. And there it also influenced by their regular physical activity in the boarding school. Okay, that was the last presentation for presentation. And then for the best oral presentation that I have mentioned before will be announced after this. We will wait the score to be calculated, and please wait for a moment. Okay, I got the score already, and I will announce the best presenter for track director physiotherapy. Okay, congratulations to Mr. Adnan Faris Naufal for winning the best oral presentation in track director of physiotherapy with the presentation entitled The Effects of Exergames on the Static Balance Performance for Children with Flat Foot, Quasi-Experimental Study. Okay, so the committees will send the certificate to you the best oral presenter after this event finished. And for all the presenter, the certificate as oral presenter will be sent to your email as well after this event finished. And for Miss Susan Lee, you will get the different certificate because during you are the invited oral presenter. Okay. Before I close the session, we will hold a photo session. Please turn on your camera and give us your best smile. Okay. 1, 2, 3.
Thank you very much for your presentation. Okay, for the next one.
Okay, I would like to thank all of the oral presenters for all your wonderful week of presentations. We have a productive and inspiring time, and our session is about to come to the very end. On behalf of the organizing committees of the International Conference on Health and Wellbeing 2023, I would like to apologize if I have done any mistakes during this activity. Lastly, wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Okay, you can leave the room, and you don't need to return to the main. Thank you, everyone. Thank you. Thank you, Miss Andy. Bye bye.